Hello, this is Dr. Safran and Professor Shufaro. They are our guests from Israel. Thank you the opportunity for shooting this interview with you. And we have a few questions from our patients, and if you don't mind, just to answer them. The first one is it more likely to get pregnant from a frozen transfer compared to a fresh one? Или по-точно, дали е по-лесно да се забремене от свеж трансфер или от замразен?
Okay, thank you for the question. Each embryo has its own independent reproductive potential, what I would call in plain language, karma. So whether you transfer it as fresh or after freezing and thawing, it will be absolutely the same. So an embryo that you will not transfer today, but you will freeze it for tomorrow, if it's the winning embryo that will end up as a live birth, then you will get it in another cycle. But on the other hand, there is no fresh embryo transfers are equal to frozen thawed embryo transfer. They are not inferior to them and not superior. So if you can perform fresh transfer, then perform the fresh transfer. And if not, then perform the frozen transfer. The same thing.
I just want to end before you translate. First of all, thank you for inviting us, and we are very happy to be here at New Life Clinic and provide our support. I just want to say that whatever Professor Shufaro said is absolutely correct, but it relies on the presence of a very good laboratory which perform the procedures of embryo freezing and embryo thawing in an optimal way. And we are very glad to say that in New Life Clinic, these procedures are done with a very high success rates.
And the embryologists are very, very, very good.
Yes, they are.
Agree.
Absolutely.
I absolutely agree.
Yeah.
Agree.
Okay.
Така, според колегите няма разлика между размразение и свежия трансфер. Според професора всеки ембрион има своята карма и поради тази причина, ако има възможност да се направи свеж трансфер, по-добрият вариант е така. Ако има възможност да се замързи, нека да се замързи. Доктор Сафран добави, че трябва да разполагаме с лаборатория, ембриолаборатория, която да има възможността да замразява тези ембриони и по този начин да могат те да след това да се размразят и да се трансферират. Okay. So next question is it mandatory to remove a clotched pipe?
Okay, I presume that you refer to hydrosalpinx. That's a clogged pipe. It's a tube filled with fluid. Now, when you have in the presence of such a finding, even on one side, the take-home baby rate is 50% than what you would expect at the same patient age and clinical situation. And removal of such a clogged tube or detachment, if it's impossible to remove it surgically, will actually double the chance to achieve a live birth. So it is very recommended to do so even before the first IVF attempt.
Okay. Според професор Шуфаро, на 50% е по-висока успеваемостта, ако тръбата или тръбите са запушени или поради някаква причина е затруднено предвижването на сперматозоидите и яйцеклетките, тъй като положението става в маточните тръби. Ако има някакъв стоп, е по-добре да се направи прекъсване на маточните тръби или да се премахнат, лапароскопски най-вече. И това е по-добрият вариант да се направи преди първия инвитро опит. What are the potential side effects of undergoing IVF with stimulation?
Okay, I would say globally that IVF is a safe procedure. And the risks of hazard of IVF are much lower than pregnancy and delivery. Okay, so it's much safer to go through IVF than what follows afterwards, the pregnancy and delivery. There are some minor risks. One is hypercoagulation, but again in pregnancy it's much more because the estrogen levels are much higher, and there is a very small surgical risk with the oocyte aspiration associated with it. Again, it is absolutely uncomparable and much less than what can go wrong during pregnancy, delivery, C-section, and so on. But the most important side effect of undergoing fertility treatments globally is multifetal gestations. And in this aspect, IVF is as safe as you can get because you have the ability to transfer just one embryo. And if we take into consideration the previous question about freezing embryos, it is absolutely recommended in most clinical scenarios in IVF in women of reasonable age to transfer just one embryo to make sure that they have a pregnancy of a lower risk, a singleton healthy, live-born, and then they can use the other embryos that they have cryopreserved with the same success rate. So, in comparing to other fertility treatments, the rate of twinning in IVF is lower, and it is possible to reduce it almost to zero by transferring only one embryo. And that's the most important message.
Okay. Инвитро процедурата е безопасна. Според професора дори по-безопасна, отколкото самата бременност и последващото раждане, независимо дали ще бъде нормално или цезарово сечение. Има странични ефекти, понякога се стига и до хиперкоагулация, това се дължи на повишаването на дозите на естрогена, до хипертензионни състояния, но в общи линии това е една безопасна процедура. Това, което той искаше да наблегне, е неговия съвет да се трансферира само един ембрион от гледна точка на предпазване от мултиплена или от двуплодна, триплодна бременност и така нататък, от гледна точка на превенция на последващите усложнения, които могат да настъпат с бременността. And I'm going to ask the next question. At what point is considered the IVF with donor eggs is the only option?
Okay, Dr. Safran.
I think that definitely the patient's age is a factor which will lead to a better or higher recommendations to use the donor option. It depends on the country what is the age limit, but usually it's around the age of 44. Even in these cases, in some of the clinics that we consult, we would suggest the patients to undergo one cycle at least with their own eggs and to see whether there was any possibility of achieving oocytes and embryos. And if not, definitely that would be the final option. I think the patient should know that doctors are not hurrying to recommend the use of egg donation. We understand the sensitivity of the issue and we always will try the best, but securing the patient reasonable chances for success. And if not, we will recommend them to go for egg donation. And finally, patients should join a proper good egg donation programs in order to have a true high chance of achieving a live birth.
Доктор Сафран сподели личния си опит. Според нея най-добрият вариант, разбира се, е със собствените си клетки, но когато това е трудно постижимо или невъзможно в някои от случаите, най-често поради възрастта и изчерпания яйчников резерв, тогава, разбира се препоръчва да се премине към донорска програма. Тази донорска програма, разбира се, трябва да е в регламентирана клиника, да се проучат предварително всички възможности и чак тогава да се пристъпи към последействие. Аз искам да използвам момента да споделя личния си опит. Имал съм пациенти, участващи в донорски програми и с донорски мъжки материал, и с донорски женски материал, и успешни бременности, и в крайен случай, когато разродим децата и когато ги подадем на родителите и когато се тръгнат от болницата, на края на уравнението няма никакво значение чия е яйцеклетката или чия са сперматозоидите.
I would just add one more thing, that of course we encounter quite rarely cases of young women with severe egg factor, and in some of those cases it becomes the only option. But this is more rare than when you discuss patients which are older, over the age of 42, 43.
Става въпрос за и млади пациенти, които поради някаква причина са с предварително изчерпан яйчников резерв. За тях също това е опция на действие. Okay, and next question is, how many times can a woman undergo an IVF procedure?
Okay, it really depends on the specific clinical scenario, and there is no code number for it or upper limit. Now, the IVF procedures are relatively safe, and there is no, if a woman needs repeated aspiration, there is no reason to delay the time between them. There is no problem going aspiration after the other. Of course, this is subject to the clinical scenario, the success rate, and the chances of achieving a pregnancy. But in a woman of relatively young age, for example, if she has a low ovarian response and she has only a few oocytes and only one embryo at a time, and she's of young age, that means that she has a good chance to conceive despite her low response, then the aspirations can be done month after month, and there is no risk associated with it.
Okay. Няма горна граница на броя инвитро процедури, които могат да се направят. Зависи от отговорът, който пациентката ще даде. Професор спомена за млади пациенти, които са дори с намален яйчников резерв, могат да месец след месец да преминават през инвитро процедура с идеята за забременяване. Тоест, there is no bench or there is no number of the IVF procedures. So the IVF procedures are not limited.
No, not medically, but you should always think what are the success rate and is it okay. So I'll give you an example. If you have a 43-year-old lady and you do one aspiration, you have 3 oocytes, 1 embryo, then you do it again and again and again. So I would say 3 tops 4 times you should go to donor oocytes, because this is not going to work. But if the same lady, for example, is 24, then I would recommend her to go on, because she will eventually conceive. So it is subject to specific consideration, and especially what are the chances of this patient succeeding. This is the most important thing. IVF is a safe procedure, and there is no harm in repeating it. I will give you another example. We spoke now only about IVF in order to get pregnant, but we also perform the safe stimulation and oocyte pickup for fertility preservation. That means cryopreservation of oocytes in order for use in a more advanced age. And these ladies, they can do one aspiration after the other, 1 month after month, until they have the quota of oocytes, something like 25, 30 oocytes at age below 35, and there is absolutely no problem in doing this stimulation and pickups 1 month after the other. Okay, the number, the limit is determined individually based on the purpose of the procedure and on the specific clinical scenario that you need to have a scope. For example, there is no logic in taking a woman of advanced stage and just doing again, because it's not, if it didn't work in the first 3-4 times, it's not going to work. And if she has a few oocytes, and advanced age, it will not work. Okay, she needs to go to donor oocytes. But
sure.
The limit is not the procedure itself; it's the scope of the procedure. What is it designed for? Okay.
Професорът даде редица примери за това кога може да се стигне до лимита на инвитро процедурите, ако жената, пациентката е по-възрастна, ако е с ограничен брой фоликули, логично е да няма смисъл да се правят процедури след процедури, но когато пациентите са млади, дори когато овариалният им резерв е намален, могат да се осъществяват дори месец след месец, като беше засегнат и въпроса за криопрезервацията на яйцеклетки, жени, които са без партньори, жени, които мислят за напред във времето, могат ежемесечно да се подлагат на пункции, така може до 15-20 яйцеклетки да бъдат замързени. Do you want to say something here because the questions they finished?
Okay, I'd like to thank the staff and managers of the New Life Clinic for accepting us here. We find this clinic to be of the highest standards in reproductive medicine, both in the aspects of the IVF laboratory and the clinical staff. And it will be, if any patient would like to have the best and top quality reproductive medicine care, so she's in Bulgaria, this is certainly the place.
Thanks. And you?
Well, I'm saying this for the last 9 years, so I was here from the very beginning, walking through the progress of this clinic, and it is indeed a jewelry. So it's a great clinic, wonderful stuff, and high quality clinical medical care, and well recommended.
Thanks, but that is more or less thanks to you.
Thank you.
Pleasure.
Yeah.
It's a pleasure.
We are your students.
Yeah, I'm very proud of you.
Thanks. Thanks for that.
You're welcome.
Thank
you.
Thank you very much.